The fallopian tubes, also known as the uterine tubes, is a structure along which eggs travel from the ovaries to the uterine cavity. Whenever these tubes are damaged, that process will not be able to happen again. The eggs during ovulation will not be able to travel through the fallopian tubes to the uterine cavity where the sperm will meet it or them for fertilization to occur. Fallopian tubes does not cause fibroids. There's no relationship. Rather, fibroids can block the fallopian tubes at its entry into the uterine cavity. The only time that fibroids can cause blocked tubes is when two separate fibroids block the entry, the mouth of the fallopian tubes into the womb. It is not a very common phenomenon. The commonest cause of tubal blockage is infection, which usually results from sexually transmitted infections. Risk factors for sexually transmitted infections will be having multiple sexual partners. Repeated sexually transmitted infections will lead to fallopian tube blockage over the time. And commonest risk factors is when the lady has multiple sexual partners. When one fallopian tube is blocked, the other tube may be okay for you to get pregnant. But when you have two blocked fallopian tubes, there is no way for the eggs from the ovaries to pass through the fallopian tubes to get into the womb to meet the sperm for fertilization to occur. So, if you are trying to get pregnant and the fallopian tubes are blocked, the chances of natural conception, the chances of natural pregnancy is very, very low. The only possible option when you have bilateral tubal blockage, that is, when the two fallopian tubes are blocked, is going to be some form of assisted conception. Not only assisted conception, in this case, we mean in vitro fertilization, that is IVF. IUI will not help in this situation because with IVF, the fallopian tubes are bypassed. Blocked fallopian tubes don't happen overnight. It takes some time. Certain infections, especially certain sexually transmitted infections, when the lady is exposed, begin to cause minute damage, which over time will now affect the fallopian tubes to the extent that fertility is now compromised. I have seen many patients coming in to say that they want their tubes to be flushed. Let me explain. When there is a blocked fallopian tube, flushing in this case does not help, because there will be a situation where they will tell you that when you flush and after a month of trying, if nothing happens, you should come back for another repeat of the flushing procedure. We know quite well that certain fallopian tube blockage may be very small. We have seen situations where HSG, that is hysterosalpingogram, which is done to ascertain the patency, whether the fallopian tubes are open or not, have helped to open up certain fallopian tubes, but not in all cases. So we cannot now generalize because that worked, that everybody that has blocked fallopian tubes should have some form of flushing. That will be all for this week. Till next week, when we'll continue to address your health and fertility concerns. Don't forget to subscribe and turn on your post notifications to get updates on our next video.